my name is Emma Medina. I am DVM 2027 at WesternU CVM, and I am interested in equine medicine, so specifically neonatology, entherio, and also emergency medicine. Going into college, I guess I was set on small animal like everybody else, and then I went to Cal Poly Pomona, and they have the full watch program there, and I kind of just fell in love with helping horses give birth and the whole baby process. So I chose WesternU CVM because the curriculum is really different than everything else that's out there right now, and I think a lot of my peers would agree that visual learning and being able to sit down with just a small amount of students is really engaging compared to the lecture style or didactic learning. And I do appreciate that we still get a little bit of that in there, because we all kind of grew up with that type of learning style. So I went to Humphrey Jacopuzzi and Associates Equine Hospital over the summer, and I did an externship there. And I kind of was really excited to go and do that because it's one of my rotation sites in the spring as well. So I kind of get to double up on that equine experience. But I chose to go there not only because it's close to where I live, but also because they have a great reproductive program, and they do a lot of breeding there, and over the summer is when a lot of the babies are born, so I got a lot of great experience with reproduction and ultrasound, measuring follicle sizes and rectal exams, things like that. A lot of really great essential things for someone who wants to work in entherio and neonatology in the future. So I decided to go straight from my summer externship into surgery, dentistry, and anesthesia, mostly because I am not as experienced with small animal, and I figured it was a really fun and exciting way to kind of delve into small animal. We have been doing spays and neuters with really great guidance, and I've been able to feel really confident even with my more equine focus. So I've been really excited and happy to do that, and it's a really good switch, I think, going straight from just being able to observe and do equine into something more hands-on. And then, I'll be going into my lab and zoo rotation, so I'm kind of just getting the whole experience really quickly. So a typical day at the surgery, anesthesia, and dentistry rotation, we start at 8 a.m. and we are currently doing a rotation at the Upland Shelter, the Friends of Upland Shelter, and it's a really great place. I volunteer there on the weekends. And we start the day really early. We get our patients out from their kennels or wherever they are, and we bring them in, do our physical exams, and then we set up for surgery. So if we're the surgeon, we get all the medication set up and get our patient all prepped. If we're the anesthetist, then we go into the actual surgery room and set up the table and the machines and get the cuff sizes and everything ready. And then we can also be the assistant surgeon, and we scrub in and help and kind of be the cheerleader for our surgeon. And we get a lunch break, and then we do another set of surgeries after that. And I will say that the days go by so quick because you are just so engaged and having a blast and, kind of just feeling like, wow, I'm really a doctor. At my externship, the Humphrey and Jacopuzzi and Associates Equine Hospital, one of my favorite cases there was this beautiful Frisian broodmare, and the baby that she was pregnant with was basically the last one for that sire. So very special baby, and the owner was very, very concerned. And she had the most adorable little baby. But he did have some issues with drinking milk. And this is something I've seen before, where they'll kind of drink the milk and then it'll kind of pop out of their nose. So that they're not really swallowing it. And it's something that, can be fixed. Lots of ultrasounds going on, lots of scopes, and eventually they found out that he had a palate issue, and they were able to schedule him for surgery. But just being able to be there and catch something like that so early, especially for those little guys, is really vital to their survival. So being able to see that firsthand and just being able to see the most adorable equine babies, I think that really inspired me, and it was one of the first cases I saw when I got there, so it was just really fun. You go into work one day and the mare's pregnant, and then you come back the next morning and there's a baby on the ground, and it's just really exciting. So the most valuable thing I learned at my equine externship was just being able to get some hands-on experience with the ultrasound and with reproduction in general. I was working really closely under Richard Jacopuzzi, and he is one of the owners of the hospital, and he's been doing reproduction and theriogenology for a very long time. He's bred a lot of horses. And just being able to watch him do his work, being able to look at an ultrasound and guess the follicle size, and he gets it right away. It's very impressive and something that I want to be able to do in the future. So just being able to actually assist him with sterile lavages and ultrasounding for the follicles and for the corpus luteum and all that fun stuff that we get to actually see in the books. Just seeing it come to life in a way is really cool. And I think it was really valuable to see him do the same thing over and over and over, because then I get to kind of see what my life would be like if I choose that path. What I found challenging is kind of probably what most of my peers go through when they first go through an externship or a rotation. We get asked a lot of questions, and not in a way that's meant to embarrass us or say you don't know this, but it's a way to kind of push you to your limits, to being able to see what you do know and what you still have to work on. So we'd be in the middle of surgery and they'd ask me, what's the length of this, or what's the tissue I'm touching? And sometimes I knew the answer and sometimes I didn't, and it was a little embarrassing in that moment, but the reason that they're doing that is because they really do want to challenge you, because these are things that eventually we are going to need to know, and it's a good way to kind of measure where you are at with your knowledge. So I would say that it was a very good challenge. It was a little scary at first, but as I go through my rotations, I'm starting to realize the intention behind it, and I do find it very helpful for my studying. As for my 2 externships that I've done so far, I am still very set on equine. However, I did kind of start to fall in love with doing spays and neuters, and I think it would be a really cool thing for me post-graduation to do some relief work at shelters, and just on the side on a weekend do a little bit of surgery to help offload the shelters a bit, get some relief work in there, and then continue with equine as my main gig. But I'm open to mixed animal now, which, if you knew me from first year, you'd be like, oh my gosh, I can't believe Emma's saying that. But I am saying it, I am open to mixed animals. So, yeah, small animals slowly getting me. You guys are getting me. So the things that I learned so far at my externships and rotations, I think in terms of carrying them into my professional career, I think a lot of what I will take from those rotations especially is going to be the demeanor of the doctors and just how they interact with clients. I know that my main goal when I go there is to kind of learn about the cases and the pathologies and all of the anatomy and physiology behind it, but I think a really valuable and somewhat overlooked part of these externships and rotations is just observing how the doctors are with their clients and how they make them feel safe and comfortable, especially on what can sometimes be the hardest day of their lives. And I think that's really important because we're going to be put in some sad or difficult situations when we're out of veterinary school. And I think having a baseline and some good ideas and phrases to use when those hardships come up. I think that's really important, and just being able to kind of learn from their mistakes in a way, and the things that they tell you when they were starting out. Hey, don't do this, or hey, maybe think of this in a different way, or something like that. I think that's really valuable. So just talking to the veterinarians and the RVTs and the assistants, getting their real life experience, I think that will translate well into postgraduate everything. So my advice for aspiring veterinarians is that, I mean, it's going to sound a little cliche, but really don't let anybody tell you what you can't do, because everybody's different. And you may look at somebody and think, hey, they're a great vet, but I'm nothing like them. Or they're a wonderful vet student, but I'm nothing like them, and I want to go to vet school. But you have to realize that everybody needs something different. And every client, every pet is going to need something different. And if you have a passion and a love for this profession and for animals, then we need you. So those clients need you, and there will be somebody out there who needs specifically what you have to offer. So yeah, I think that people overlook how uniqueness and diversity can really benefit the veterinary community, and not just us as professionals, but also our clients and the pets that we take care of. My advice for first and second year students is to just keep chugging and build a community. Find some people that you can really trust, and not just students, but also faculty. Go to therapy if you need it, to have somebody to talk to. Rely on your family and your pets if you have them, because there are going to be some hard days, but as long as you have the coping skills to handle them and the support system to get through it, it will be okay, because you can handle anything, and sometimes it might feel like you can't, but that's why there's third year students like me and all of my peers who are here to support you and tell you that you can. And you will be at this stage soon enough, I promise. So just keep moving, and you'll get to where you want to be, I promise.